This section is called Nursing Care of the Patient with EDS. And in this section, you'll identify 2 patient care priorities in an EDS clinical patient scenario. 21st century nursing is the glue that holds a patient's healthcare journey together. In thinking about nursing care, one of the concepts that really should drive us is that care should be patient-centered. So whether it's as an organization, we should be striving for patient-centered care, or as an individual healthcare professional, we can strive to provide patient-centered care. Often we can do that more as individuals than trying to, have a grand influence on everybody around us. Though hopefully by being patient-centered ourselves, our example can influence others who also are providing care. Ways to determine if our care is patient-centered are identified in this image, starting at the top, that our mission and values are aligned with patient goals, that care is collaborative, coordinated, and accessible, that physical comfort and emotional well-being are top priorities, the patient and family viewpoints are respected and valued, the patient and family is always included in decisions, the family is welcome in the care setting, full transparency and fast delivery of information. All of these are things that we need to be striving for in providing patient-centered care. And when we get there, this is how we will know that we're achieving patient-centered care. So let's think about, what do patients want in their nursing care? And again, we're going to our survey results. And the guiding principle for this section is that we need to individualize patient and family care, especially when we're dealing with people who have such unique needs as people with EDS. This needs to always be our goal with any person, any patient and family, but so much more so with people with EDS. As you've seen, there are so many unique needs that they have, and each person with EDS may have different kinds of manifestations, different kinds of comorbidities, different needs and different strengths. So individualization is that much more important. And I love this quote, and what you'll find if you're not part of the EDS community yet, people with EDS see themselves as zebras. And that's actually their mascot. And it's awesome. And this quote says, "We are the zebras. We may have symptoms and reactions you don't expect or haven't seen in other patients." And for those of you not familiar with the idea of zebras, in clinical decision making a diagnosis, when you hear hoofbeats, think horses, not zebras. At times you need to think about the zebras too. And this is when you're going to see those unusual things, is in the person with EDS. Listen to us. As you can see, this was a very prevalent theme. We talked about it in the last section. It's really relevant here as well. It's one of the overlying concepts that's going to drive our nursing care and our ability to individualize that care. You need to learn about EDS to provide safe, quality care for us. Doing courses about EDS, learning all that you can about EDS so that you can provide effective, safe, quality care. Believe and trust what we tell you about our symptoms and needs. Getting back to the idea in the previous section, patients have felt invalidated. They have found it hard to find trusting relationships with healthcare providers because so often people have not listened to them or they've had negative care experiences. What's the most important thing? Believe us, listen, and be open-minded. What should nurses know about EDS? My skin tears easily, bruises easily, and hives up with abrasions, tape, or sustained pressure. My joints are very loose and sublux easily. I have a lot of allergies of all kinds: foods, meds, fragrances, dust, etc. I'm very sensitive to smells, sounds, and lights, as they can cause migraines, nausea, vomiting, or asthma. I also need as much sleep as I can get, or all of my peripheral conditions flare up. Pay attention to my detailed needs and please be gentle with me. We need you to be compassionate. Don't doubt us when we're concerned about something going on with our bodies. One of the ideas that I heard a lot in the data was this bottom one. If a person with EDS is in the hospital and they're saying something is not right, even if they don't know exactly what's not right or the symptoms don't seem to make sense, take those concerns seriously and try to figure out what is at the root cause of that, and think about all the different things that are going on with that person. What's the most important thing nurses should know? To listen, believe that the nurse or doctor's conduct and belief is just as important in reducing pain and increasing treatment effectiveness as the patient's, maybe even more so. That EDS POTS pain flares are real and need IV saline. Each person with EDS is different. We know our bodies, so please listen to what we tell you when we're concerned about something and ask us about our prior experiences. This idea of what has worked for you in the past, what has not worked for you in the past. In a previous section, we learned about the effects of anesthesia and pain medication and sutures and things like that. And so taking it beyond just what's on that pre-printed sheet or computer screen of questions that you should ask prior to a surgical procedure. Take it beyond that and ask about their detailed needs. If you know a person has EDS, they're going in a procedure or surgery, find out what has worked and what has not, and how does their care need to be individualized. What's the most important thing nurses should know? To listen to the patient, be open-minded, and trust that the EDS patient knows what issues they have. I think we're seeing a lot of these same themes, aren't we? Believe the patient, even if it contradicts what you've learned. There's only so much that books can teach us. It's not complete. People with EDS are going to teach you new things. Be open. Be open to learning and listening and believing. We may not look sick or in pain when we are. You should do a thorough, careful assessment. We adapt to our symptoms, so they may not be evident on exam. So when somebody with EDS who has experienced chronic pain, chronic GI symptoms, chronic lightheadedness with their POTS, chronic immobility, when they complain of symptoms, remember that there's that baseline pain. They've adapted to a lot of those symptoms, and so you're not going to see acute changes in their vital signs. You may see much more subtle symptoms, and they may not rate their pain or their other symptoms as highly as you might expect. Or if they're rating them highly, think they already have a baseline of feeling that way. So if it's a high rating, it must be very distressing. What's the most important thing nurses should know? That we can look fine and not be okay. Look for those subtle symptoms. Look for those subtle changes on exam or in their vital signs. We may have normal tests and scans despite our symptoms. Refer us to experts when you don't know enough. I've heard this time and again that because some of these changes are very subtle and happen over time, you may not see dramatic abnormalities on tests. ultrasounds and CAT scans and things. Many people with some serious conditions have related to me that they have had normal tests even when they had something very serious going on. So pay attention to the subtle things. What should nurses know? Validate concerns. Refer to appropriate specialists based on concerns as warranted, and provide emotional support. I think that emotional support is the thing that all too often is lacking. We're really good at going ahead and doing the job, but providing that emotional support when somebody who has already come in so fragile and with so much baggage, providing that emotional support can make all the difference in how they feel about their care and in whether they're willing and able to trust you and to follow through with what you want to do in conjunction with them. We often don't respond to anesthetics well. Often it doesn't work the first time, or we come out of it during procedures. That whole idea is just very frightening to me. We're tough, but we're also fragile. Please be gentle with our joints and skin. We often have chemical sensitivities that can produce strong reactions. We know a lot about our symptoms and what helps them. Please listen to us. We are in pain. So if we're grumpy, please be kind and patient. You need to think outside the square and collaborate with us to find solutions. We don't often respond in typical ways to things that work for most other people. Think about that autonomic dysfunction. They may have changes in their temperature, changes in their heart rate, changes in their blood pressure that are different than what you would expect in somebody whose autonomic system is working normally. Sutures do not hold. Please double up. We're not lazy or stupid, merely struggling with mental and physical elements of the disorder. What should nurses know? That multiple symptoms can mean a multi-system disorder, not simply that the patient is mad, as I was taught at medical school. To take an accurate history, often the key information is in the fine detail. Listen to a patient's previous experiences. Things like local anesthetic failure or sutures not holding are uncommon in the general population, but relatively common in EDS. Believe what patients tell you, even if it sounds odd. And this is coming from a physician. Be gentle with us as we injure easily. Ask us what works on us as individuals before you move us or do something. It can be difficult and take time for us to move. Don't rush us. So thinking about what we have to do all the time, helping people transfer to the commode, helping them ambulate, helping them turn, reposition, all of those things which we do so routinely should not be done in a routine way with people who have EDS. Remember, by pushing on somebody's leg to turn them, you can dislocate. You can subluxate a joint. Pretty dramatic, but it is true, and it can happen with somebody with EDS. Holding their arm the wrong way or holding underneath their arms, all of those can cause stress on their joints and on their skin and cause injury. What's the most important thing nurses should know? How to recognize or screen for EDS, dysautonomia, and CSF leak. Those will be future topics in our EDS educational series. Know the complications that make it really important to screen or recognize that our scans are often normal despite the symptoms. Know that our bodies respond to treatment differently, and treating us like we don't have EDS can be dangerous. Remember all those different chemical sensitivities that people have, the dysautonomia. These things are all really important to remember as we're treating people. That we may need more anesthetic and we may metabolize drugs or iron differently. The dislocations aren't imaginary, that it's not just stretchy skin and bendy joints. There are systemic complications that affect treatment decisions. That the UK EDS GP Toolkit exists. You'll learn about that in another course. That asking for IV saline is not drug seeking. People with POTS may very well need IV saline to manage and stabilize their condition. That EDS POTS pain flares are real, agonizingly awful, and need IV saline. To listen and believe that the nurse or doctor's conduct and belief is just as important in reducing pain and increasing treatment effectiveness as the patient's, maybe even more so. What's the most important thing? Teaching patients how to manage their own healthcare team and how to navigate the healthcare system in conjunction with their general practitioner. It's important to give patients the tools to coordinate their own care, and nurses have an important role to play in educating patients and empowering them to take charge of their health and to advocate for their own healthcare needs. I think this idea of teaching and empowering and helping people navigate is so critical because we're only going to be with them for a short time. But when they can manage themselves, it gives them the tools and the power. We will have a course coming up on this topic. So in summary, nursing care of the patient with EDS, the guiding principle is to individualize patient and family care. Get to know us personally as individuals and a family. I need to be able to trust you, and you need to trust me. So being on the same team is incredibly important to a single mom with EDS and her little zebra dazzle Shiarians. I'm strong, and I don't put myself first often enough. So someone knowing me more personally sees when I'm not willing to admit that I'm having a complication because I have more on my plate that needs done before I can focus on me. Not to mention, empathy comes significantly easier in both directions when you genuinely enjoy seeing one another. And trust me, you'll see a family like mine a lot.